Imagine sitting in a cold doctor's office. You've just been told your blood work is concerning. Your PSA is high. Suddenly, your mind spirals. You're thinking about biopsies, needles, months of waiting, and the C word. But what if I told you that for the last 30 years, we've been using a compass that's broken? A test that sends millions of men into unnecessary surgery while letting the most aggressive killers slip through the cracks? Today, we are breaking down a medical breakthrough so precise, it's being called the 97% solution. A simple blood test that could save you from the most painful procedure in urology and save the healthcare system $2 billion a year. In this video, we're going behind the scenes of a new technology called PSE. We'll look at why the current gold standard is failing you and the specific 3D DNA shapes that are changing everything. If you or a man you love is over 40, you cannot afford to skip a single minute of this, because the old way isn't just outdated, it's dangerous. To understand the future, we have to look at the flaw in our current defense. The PSA test, Prostate Specific Antigen. Developed in the 90s, the PSA was never meant to be a yes or no for cancer. It was meant to monitor patients who already had it, but we turned it into a screening tool. Here's the problem. The PSA is a leaky marker. Think of your prostate like a balloon. If you poke it, it leaks PSA into the blood. But here's the catch. Cancer isn't the only thing that pokes the balloon. Did you go for a long bike ride this morning? Your PSA goes up. Are you dealing with a simple infection like prostatitis? Your PSA goes up. Did you have sex in the last 48 hours? Your PSA goes up. This creates the false positive trap. Millions of men are told they might have cancer, leading to biopsy anxiety, a psychological weight that can last for months. But even worse, the false negative. Some of the most aggressive ductal cancers don't produce PSA at all. They are invisible to our current tests. When the PSA fails, we go to the MRI. Now, MRIs are brilliant. They are the cameras of the medical world, but they have two massive enemies: access and cost. In places like Australia, the government might help you out, but in many parts of the US or UK, you could be looking at a $3,000 bill or a 4-month waiting list. Can you imagine waiting 120 days wondering if a killer is growing inside you? Scientists asked, what if we didn't look for the protein the cancer makes? What if we looked at the instructions of the cancer itself? Enter the PSE test, the Prostate Specific Epigenetic test, developed by the geniuses at Oxford BioDynamics. This isn't just a blood test, it's a 3D map of your DNA. You see, your DNA isn't just a code, it's a shape. Every cell in your body has the same DNA, but a heart cell folds its DNA differently than a skin cell. Cancer cells have a signature fold. The PSE test uses a proprietary technology called EpiSwitch. It looks at 5 specific epigenetic markers. It's essentially facial recognition for cancer DNA. By combining this 3D DNA mapping with your PSA score, the results aren't maybe. They are binary, high likelihood or low likelihood. And the speed? You get your answer in 4 to 5 days, not 4 months. Let's talk numbers, because this is where it gets life-changing. The PSA alone, roughly 79% accurate, with a pathetic 33% sensitivity. It's basically a coin flip that leans in favor of the house. The PSE plus PSA combo, 94% accuracy, 86% sensitivity, and a staggering 97% specificity. Let that sink in. If this test says you are clear, there is a 95% probability you are actually clear. In a landmark study of 187 patients, researchers found that 79% of men, nearly 8 out of 10, could have skipped the biopsy entirely. We aren't just talking about saving money, though $2 billion in savings for the US healthcare system is nothing to sneeze at. We are talking about saving men from the physical trauma and potential side effects of unnecessary needles. So, is the MRI dead? No. Especially in high-resource areas like Australia, the MRI remains a vital tool for locating exactly where a tumor is. But the PSE test is the triage officer we've been waiting for. It's for the man with the rising PSA, but a normal MRI. It's for the man in a rural area who can't get to a PSMA PET scan. It's for everyone who wants a concrete answer now. The medical world is shifting from let's cut and see to let's decode and know. If you're watching this and you've been told your PSA is high, don't panic. Ask your urologist about epigenetic testing. Ask about the PSE score. The power is moving back into the hands of the patient. If you found this breakdown helpful, hit that subscribe button. We're tracking the latest in medical tech every week so you can stay ahead of the curve. Your health is your greatest asset. Don't leave it to a 30-year-old broken compass. Watch this next video on how to know signs of prostate cancer. I'll see you there.